patients have commonly expressed a range of concerns that may affect them when going through the treatment, whether they are starting the treatment or whether they are in the midst of the journey or whether they are coming towards the end of their treatments. Majority of these concerns are around the issues such as the consistency or clarity of the information that is being shared with them, whether it is related to the clinical aspects, whether it is related to newer interventions, or whether it is related onto the care that they are going through when they are going through the treatment, or whether it's related towards the treatment prices, treatment costs. I think these are a range of the issues that they have experienced. Some of them may also feel that the lack of continuity of care leads to numerous communication gaps and conflicting information. Well, matter of factly, it might be the same information being conveyed differently by different people at the clinic. So what I would say in my view is that the main challenge that the fertility industry at the moment is facing is the communication of the information to the patient and being sensitive to the patient needs. So communication to me boils down to three main groups, and one of them is the clinical information. And clinical information, therefore, it is important that we have more clarity on publication of publishing of the success rates. We should clarify the duration when these success rates are being published for. What is the denominator we are using, whether we are suggesting it's a clinical pregnancy rate, whether it's a live birth rate. And we should discourage setting league tables, which many clinics do that, because they are not like-to-like comparison. And given the information that the patients have, the amount of the information that they have to assimilate, they might not be able to make the best informed decision for themselves. And going on to this point itself, it also leads to me is that where we have to be realistic in communicating and setting patient expectations. And this again leads from the clinical aspects, but also involves other aspects such as clarity of the costs. There is a hugely fragmented way the costs the patients are being charged. Some patients may upfront be aware of certain costs, but equally when the patients are comparing the clinics, it might be the basic IVF package cost. What they lack clarity is what is being included and what is being excluded, and what extra costs that they have to bear on the top of the mind. So this lack of clarity of information might lead them to choosing clinics which they initially thought may be more cost-effective options, but might not turn out to be. So that is where I feel is expectation setting, helping patients in making better informed decisions. And therefore, both leads me to the third point, is introducing more transparency, both for clinical information and the treatment prices. Coming on to the second point of the sensitivity to the patient needs, I think here is more about we are in an age where women do wish to manage or balance both their professional and personal priorities, and I think it is a responsibility of the clinics when they're coming to the treatment is to help them do so by providing more choices, more convenience, more flexibility, so that they can continue with both. So in terms of London IVF Genetics Centre, it's been established keeping these few things in mind. So here we provide a total continuity of care, so they see the same clinician or consultant all the way through the treatment, right from the beginning of their journey, through their journey till the end. So any communication addresses or patient concerns are addressed in real time. There is no translation of the information, so therefore it makes for a better patient experience. By giving a range of appointments from early evening, weekend appointments, exclusive appointments, and even an option of out-of-hours monitoring appointment, we are helping our patients achieve that balance, which is so vitally needed these days. So these are some of the aspects that we take care of when we want to address some of the challenges that are burning out there for the fertility industry to look into.